Fox, who's a physician assistant with Sound Clinic. Welcome, Sheri. Very excited to have her. And just to give you a little bit about Sheri, Sheri is a native and graduated with a Bachelor's of Science in Molecular, Cellular, and Developmental Biology and minor in biochemistry from the University of Colorado. She found her life's work in medicine when she went on to Emory University in Atlanta, Georgia, to graduate with highest honors from the School of Medicine's Physician Assistant Programming, earning a master's in medical science. Currently, she is a physician assistant with Sound Clinic, and she does hold physician assistant's licensings in both Colorado and Michigan. So let's turn it over to Sheri.
Good afternoon, everybody. Thanks for joining us on this beautiful Sunday Colorado afternoon. I'm sure most of us would be rather be out hiking or doing something outside in beautiful Colorado, which probably got us into the position we're in the first place. Thanks to Joanne and Jody for providing this platform and support for the Lyme community. A little bit, am I still on? A little bit, we were going to talk today just about the Sound Clinic where I currently work, just an overview of the offerings and sort of the practitioners, what we offer, and then how I got into this. And then we'll talk about Lyme, chronic illness, mold, a little bit of those things, and then open it up for questions. So the Sound Clinic was started in 2008 by Dr. Sean Naylor, who's an osteopathic physician. He's a doctor of osteopathy, a DO, very similar training to medical doctors, but they have more, in general, more of a holistic mindset for a lot of them. And he started the clinic by himself to address kind of a growing need of what he saw were patients that were falling through the cracks of conventional medicine, people that weren't served by the conventional medicine model. Today, we have grown quite a bit in those last 13 years and now have 10 providers in 2 different locations. We have a location in Denver, pretty close to the aquarium. That's the office that I work out of. And then we also have a smaller office in Louisville. The approach to the clinic, it's a fantastic practice that has drawn a lot of like-minded practitioners that are all very different, but all have sort of an underlying desire to treat the root cause of illness and help people truly get better instead of just treating symptoms. And when you talk about the conventional medical model versus more of an integrative or functional model, which we use at the Sound Clinic, you could think of it as maybe say a thyroid disease and having somebody see a traditional endocrinologist where they may diagnose somebody with thyroid disease by doing a TSH, a T4, maybe some thyroid antibodies, and finding that they have an autoimmune thyroid condition, telling the patient that we don't really know why your thyroid is being attacked by your immune system. Eventually your body will, destroy your thyroid gland and you'll need to be on thyroid replacement for the rest of your life. And rarely do they ever repeat thyroid antibody tests or follow that process. So integrative or more functional medicine approach to something along those lines would be to do an expanded thyroid panel, looking at all of the thyroid hormones, reverse T3, nutrient deficiencies, things that could be a cause of autoimmunity like gluten, dietary sensitivities, chemicals, toxic exposures, but also infections are also very common causes of autoimmune diseases, not of just the thyroid, but of anywhere in the body. And by looking at a more widespread background for what causes illness, it gives us a much more varied approach and many more opportunities to intervene and actually make changes. We often see thyroid antibodies go down and have often normalized people's autoimmune conditions that were thought to be not treatable. So the practitioners at Sound Clinic, there's a number of us, and those can be divided into a couple of different groups. We do have an integrative family practice. Sarah Tyler is a nurse practitioner that has been with us for a number of years. She does a lot of women's health. She does have a functional approach to women's health and does a lot of annual exams, does a lot of stool testing, does a lot of hormones as well. Dr. Donna Diamond is another osteopath. Her background is in Ayurveda, massage therapy, and she does mostly women's health, as well as takes care of a lot of the men in our practice and does see kids as well. She does osteopathic manipulative therapy, which is kind of similar to chiropractic care, but very different. She does a lot of muscle energy techniques, sort of massage informed adjustments, and does hormone replacement as well. Dr. Lindsay Naylor is Dr. Sean Naylor's wife. She is also an osteopath, performs a variety of services, does not do primary care at our office, but she's more of a musculoskeletal health specialist. Her variety of OMT, osteopathic manipulative therapy, as she describes it, is full body unwinding. She will do acupuncture, infrared light treatments. She is also doing pellets for hormone replacement, does a lot of thyroid illness, and does functional testing as well. Dr. Josh Krems is an osteopath. He is a biodynamic osteopath. It's difficult to explain biodynamic osteopathy other than it is a very gentle approach. It can be used on neonates, infants. He does work with pregnant women. Dr. Josh is very passionate about what he does and is now starting to get into more exploration of the mouth, tongue tie, the oral facial sort of effects on the rest of the body and breathing, and why people stay chronically ill that may have issues that haven't been addressed there. I believe he's actually in Virginia this weekend doing some additional training, getting more training on an oral appliance called ALF. I believe it's ALF. And he's going to be working with a dentist in Boulder to sort of specialize in that. Jody Yemen is our newest addition. She's a nurse practitioner that is very integrative, but also does conventional medicine. She's a women's health specialist, and she does hormones, thyroid. And then for the chronic illness team, I guess, which we would call ourselves, Amy Kennedy is a physician assistant. She actually was the person who trained me years ago when I joined the Sound Clinic in 2015. Amy has a background in biology and has done some training in Chinese medicine. She's currently residing in Australia, so she is only available for telemedicine appointments, but is a very gifted clinician. Sean Naylor, of course, the physician that started the practice, has been treating chronic complex illness for well over a decade now. He also does prolozone, which is a type of injection technique using procaine, as well as ozone that can be very effective for chronic pain, joint issues and instability. He does something else called neural therapy, which is an injection of an anesthesia called procaine into areas that might be scars, that might be trigger points, that can be also helpful for chronic pain. Most of his practice is dedicated, well, virtually all of his practice is dedicated to chronic illness, but he does have some availability for the injections as well. Mike Kehoe is a physician assistant who's also a PhD. He's in our Louisville office. He's actually transitioned to telemedicine now. And he does, again, the chronic complex illness, which for us a lot of times ends up looking like chronic Lyme infections, mold, mycotoxins, other environmental chemical exposures. And then one of the wonderful things about our office is we have a practitioner who is Lana Weinberg, who's a wellness practitioner. So as many of you know, dealing with chronic complex illness is very difficult. By the time most of our patients end up at our office, they have been not only financially, but emotionally drained. Most of our patients look very normal and so often are believed by other physicians, by their family members, and have had little support along the way and have often been traumatized by the medical community, as well as other traumas that they may have had in their life. So Lana is a wonderful addition to our office, and she provides sort of the emotional, spiritual care component for patients that are interested in engaging that, which can be a very important part of healing. One of the other great things about our office is we do take insurance. Dr. Naylor is very insistent upon doing that. We are one of the only offices I'm aware of that takes insurance to do this level of work with chronic complex illness. And that is wonderful to be able to offer that to people. He has done that to expand care to the community. As many of you know, being sick for a long period of time is costly, and most of our patients have spent thousands, if not tens of thousands of dollars on trying to figure out what's going on with them and trying to treat. So that at least helps a little bit. It's still expensive to treat chronic complex illness, but taking insurance helps a little bit. The services that we provide at the Sound Clinic, primary care, women's health care, of course, some regenerative medicine with the Prolozone, functional medicine, which can involve a number of specialty tests. So we do use a number of specialty labs. Most of the time, I think most of us would start with LabCorp. We do have a LabCorp draw site in our office and do cash pricing through LabCorp for patients that don't have insurance or don't have good insurance coverage. And there's a lot that you can learn just from doing standard labs for us, maybe more expanded labs. But then when we do advance into other specialty labs, so we use Great Plains for mycotoxin illness and toxic exposure. We use organic acids through them. Genova, there's a number of specialty labs that we use to help fill in the missing pieces. We also do IV therapies at our office. We have a fairly extensive IV selection. So we do everything from Myers cocktails, which is hydration with some B vitamins, magnesium, vitamin C. We do have a vitamin C IV that we do that's more vitamin C focused with some minerals and zinc and magnesium. We have a migraine cocktail. We do B12 therapy. We do some amino acid therapies, as well as a couple of other IVs for energy or weight loss. We also offer ozone. Ozone is what I like to call electrified oxygen, which is O3 instead of O2. Ozone is an oxidative therapy like IV vitamin C, and it can be great for many illnesses, including viruses. COVID actually responds to ozone. They've done studies on Ebola. It's a nice therapy for Epstein-Barr virus. It's also great for exercise intolerance, athletic performance enhancement, but also for brain fog, fatigue, and we use it, of course, against Lyme and co-infections as well. The unique thing about our office is we do something called OHT, which is not commonly offered. OHT is actually a bigger machine that we use. MAH is what most offices would use, and that is probably a liter of saline. They take about 60 cc's of blood out of the patient, put it into the IV bag, take some ozone gas, put that into the IV bag, and then run it in. It takes about 45 minutes to an hour. That's MAH. OHT is different in that it probably contains 30 to 60 times the amount of ozone that MAH does. So it can be a very a more potent way of using ozone, and that's done in passes. So somebody would be hooked up to the IV, hooked up to the ozone machine, and the machine would draw blood out into a bottle. Ozone is bubbled up into that bottle, and then the blood is run back into the body. That is a 1 pass. So you can go anywhere from a 1 pass all the way up to a 10 pass, which would be out and back 10 different times. That takes 2.5 to 4 hours, depending on how well the IV runs. And the other thing that we offer is ultraviolet light therapy, so UVB therapy. That's usually combined with something like MAH. Ultraviolet light is another bug killer, great for viruses. So a little bit about my story. I did grow up in Colorado. I got into, PA school. And after, discovering that I wanted something that would keep me learning my entire life, which medicine has definitely done, and started practicing in Northern Michigan, where I saw a lot of chronically ill people, and was in a medically underserved community with people that had no real access to good food, didn't exercise regularly, had a lot of challenges, and started realizing that conventional medicine, where there's sort of a pill for every ill, was not really helping people get better. It was just creating chronic patients. So I started studying functional medicine probably around 2009. I had started studying hormone replacement prior to that, and ended up getting certified by the Institute for Functional Medicine in 2013. And then found my way to this sound clinic. Prior to that point, I had been treating patients in family practice and had been incorporating some of the things that I was learning. When I started in sound clinic, I discovered that many of the issues that I had myself were common issues that I was seeing in my patient population, tested myself and found that I had everything that my patients had. So as with most of us that are in this chronic illness realm, most of us have had our own experiences with this. I did have a tick bite when I was about 9 or 10 years old. Never realized that anything had come of that. Have been exposed to mold multiple times throughout my life. Have spent my life in the woods. That's where I would be right now if I could be. So have gone on my own healing journey. So I think that for all of us, Mike Kehoe, Dr. Naylor, all of us have had similar experiences, which indeed gives us, I think, a little bit more compassion and understanding when we're working with patients, because we have been there ourselves. So when we look at chronic illness, our patient population for the chronically ill tend to be patients that have been ill for a number of years, often decades. And many of our patients have seen multiple physicians, 20 to 30 physicians, a number of specialists. Most of the time we're told there's nothing wrong with them. Your labs look fine, your tests look fine. Maybe you have anxiety, maybe you should take this medication. And so some way or another, they usually find their way to our office, and we start trying to unravel the bigger puzzle of why they are sick and what is keeping them sick. Oftentimes, we see patients from all over the country, patients from Colorado, like myself, who have gotten tick bites in Colorado, or who have traveled all over the world and have come into contact with Lyme and associates, and may have been healthy for a period of time. And most commonly what we'll see, we certainly see patients that have been sick their whole lives, but oftentimes we'll see patients that were fairly well until a precipitating event happened, something stressful, divorce, an accident, a surgery, maybe a pregnancy. After pregnancy is a really common time for Lyme to flare up, or mold exposure. Mold's a big one, even in Colorado. We see a lot of times, the immune system has been doing very well until somebody moves into a moldy building. The mold dysregulates the immune system, kicks open the door, and out come the infections. I like to describe it as a jailbreak. So then the infections are running the show, and your immune system is struggling to try to maintain. Lyme is a very controversial subject. As many of you know, the CDC has not been great at acknowledging that chronic Lyme exists, and there's a number of reasons for that. Politics, pharmaceutical companies, there's a couple of different camps, the IDSA, International Disease Society of America, the Infectious Disease Society of America, has long held that chronic Lyme does not exist, that people can be treated simply with 3 weeks of doxycycline after a tick bite. and that people that suffer longer term after that are called post-infectious Lyme disease, something along those lines. It's not a term that we use because it's not something that we believe in. There have been articles published by Embers, most notably, showing that Lyme disease does persist. This was a study done in monkeys, even after treatment with doxycycline. The CDC has recently changed its numbers from saying that only about 30,000 people per year are affected by Lyme disease to saying now that there's 300,000 people per year. And that is probably still an underestimate. There are a number of reasons why we think that Lyme is expanding. One could be warmer temperatures. Ticks are now surviving throughout different times of the year where they may have not been able to survive before. Migratory birds are bringing ticks into different areas. And the number of other stressors on the immune system are significant. And those can include pollution, chemicals, EMF, Wi-Fi, any of those sorts of things all add up to putting stressors on the immune system. And mold is another big one. And all of those things combined are one of the reasons we believe that chronic infections, as well as all of those other things, are creating more illness now than we've probably seen in the past. People seem to be sicker now, harder to treat than in years past. And may take a little longer to treat. So typical history, from somebody who we usually see, we don't see very many acute tick bites at all. Every once in a great while, we see an acute tick bite. Most of our patients don't remember having a tick bite. Only about 40% remember having a tick bite, even less recognize an EM rash. It's thought actually that the EM rash could be an immune system response to having previous exposure to Lyme disease. So that could certainly be an explanation for why so few people have it. It also appears that it may be related to where in the country you are when you're bitten. But oftentimes those people are felt to be the lucky ones because they find out early that there's something going on. They realize that they got a bite and they get treated right away. That does work for some people. If they do get on an early course of antibiotics, doxycycline is what's usually recommended. Oftentimes, in my experience, I see a number of people that have been undertreated with doxycycline. They're given very low doses for short periods of time, which probably is not effective. And the tricky thing with treating for Lyme disease is it's never just Lyme. So Lyme co-infections are the norm, not the exception. And ticks are what we call nature's dirty needles. They can contain up to 250 different organisms in them, not only including bacteria like Lyme, but parasites like Babesia, but other types of parasites, viruses. So they can be chock full of things. Confusing the matter even more is that Lyme is not only transmitted by ticks. There are case studies showing that this can be transmitted by a number of different entities, including spiders, mites or bed bugs, fleas. We've seen a number of patients that have had exposure such as that, and have gotten very sick after the fact. And those are not often considered to be vectors that can transmit those things. So misdiagnosis is the norm for people. It's estimated that the early treatment fails up to 35% of the time. People will go on at some point later to develop symptoms. If people are lucky enough to get the EM rash and get treated, but those that aren't, many of them do end up later within days to weeks of having the bite, having flu-like symptoms that can be headaches, neck pain, abdominal pain, fevers. these bugs can affect every system in the body. So initial presentation is maybe that of a flu-like illness, may not be anything. So oftentimes the patients that we see have been dealing with symptoms for years that don't really fit into a conventional box where they can get labeled, or they have been labeled with many types of diseases, including fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, MS, and a number of other things that aren't, in our opinion, real diagnoses, or at least diagnoses that give you something that you can actually treat. The beauty of Lyme disease, and when I say Lyme disease, I mean Lyme and all of the co-infections that go along with it, is that it is treatable. It's not fast to treat when you're dealing with a chronic picture. Typically, the longer people have been sick, the longer it takes to respond to treatment. Although, if there's one consistency amongst all of this, is that every person responds differently to treatment. And no two people will respond to the same treatment in the same way. So that is one of the reasons I think that it's so difficult for the traditional medical community to accept this, is that you put 100 people with Lyme in a room, and I always say you'll have 100 different presentations. Some people will have more neurologic symptoms, and the most common symptoms that we see with Lyme are neurological. So that can be anything from headaches to sleep disruption, brain fog. Cognitive complaints are really common, word finding issues. Sometimes people have difficulty with focus, concentration, may have loved to read, can no longer. We also see pain as being a common presentation. So it can be muscle pain, joint pain, nerve pain. It can be pain that comes and goes, moves around. That's one of the hallmark symptoms that Dr. Horowitz speaks about, that nothing else really does. You might have knee pain one day, shoulder pain, another day. We might have varying joints that swell up, but good days, bad days, and pain that comes and goes is very typical. And then the other most common symptom we see with Lyme is fatigue, and it's more of an exhaustion than it is a traditional, what you would think is, I'm just a little bit tired. Lyme can affect any system in the body. So we see a lot of hormonal disruption. We see a lot of interstitial cystitis, a lot of bladder issues. And again, no two people will have the same symptoms. So while some might be dramatically affected from a neurologic standpoint, somebody else may have no neurologic symptoms at all and may have more joint pain. So that is the challenge to treating Lyme, but also the beauty of it is that an individualized approach is what is necessary and the most effective. And so that is the way that we approach Lyme treatment at the Sound Clinic, is to look at the individual that's in front of us, see what all of the variables are that may be entering into their clinical picture, and then as Dr. Horowitz likes to describe it, start taking nails out of the foot. So I always say you come in with foot pain and there's like 26 nails in your foot. We have to figure out what all those things are so that you can start healing. And we don't necessarily need to remove every single one of those things, because the body does have an innate wisdom and does know how to heal itself. But we just need to oftentimes provide some assistance in starting to move those things so the body can do what it does know how to do. So other bugs that we commonly see would include Bartonella. Bartonella is another bacteria like Lyme. It's not a spirochete though. Lyme is a spirochete, a lot like syphilis, just much smarter. Bartonella definitely can come from cats. Cat scratch fever is something that Bartonella causes. So we see that a lot with fleas or bed bugs. I've had a number of patients that have been made very sick by bed bug bites or flea bites, and have been missed even by seeing infectious disease specialists for this. So Bartonella has a number of symptoms. It can cause headaches, it can cause migraines. In more severe forms, it can cause seizures or seizure-like episodes. It can cause a lot of mental health issues, so depression, anxiety, sometimes dissociative types of episodes. Even schizophrenia has been associated with Bartonella. It can cause ringing in the ears, floaters in the eyes. It can cause sore throat, swollen glands. It loves the nervous system, so it causes a lot of numbness and tingling. Also loves the joints. There are a number of studies. Veterinarians are actually a really great human model for what happens when humans get Bartonella, because they're exposed so frequently. And there's a number of case studies where veterinarians have had to have bilateral hip replacements in their 40s because Bartonella has destroyed their joints. And that was confirmed when they took tissue from the actual joint surgery and sent it into the lab, and they stained it and found Bartonella to be present in every tissue that they checked, the bones, the connective tissue, all of it. Another common symptom with Bartonella is plantar fasciitis, or pain in the bottom of the feet. The other one of the top bugs that we see is Babesia. Babesia is a parasite, a lot like a malaria. It is commonly transmitted by mosquitoes, as most of you know. So makes sense that something like a mosquito could transmit something like Babesia as well. Common symptoms with Babesia are day sweats, night sweats. Night sweats are probably a little bit more common. Neck and back pain, neck and back popping. Some of the hallmarks that we see for Babesia symptoms would be air hunger, feeling like you can't get enough air, rib soreness, costochondritis. Rib pain is a very typical symptom with Babesia, especially later on. Can cause anxiety, heart palpitations. Actually, all of these bugs can affect the heart. Babesia also can cause a lot of insomnia. So the other thing, why do people stay sick with these sorts of things? One of the reasons I think is because not all of the identifying factors have been identified. So testing for Lyme and co-infections is very ineffective. The Western blot is less than 50% effective. That's the standard test that would be done by conventional medicine. We do occasionally run what's called a Lyme blot from LabCorp, and we do find positives on occasion. Most conventional physicians would say that those are false positives. So that's one of the reasons that many patients who have Lyme and chronic infections are not diagnosed appropriately or not treated is because of the state of testing. Testing for infections is nowhere near where we need it to be. So the other tests, you can test for Bartonella and Babesia through LabCorp and Quest. Honestly, I have never seen a positive test for Babesia or Bartonella on LabCorp. So most of the time I don't even run those tests. Bartonella and Babesia are the most common co-infections that we see with Lyme. There are other infections that you would think would be more common, like anaplasma and Ehrlichia. Those we don't see very often and usually respond to treatment. For the other infections, Mycoplasma is another bacteria that can also cause pneumonia really commonly. It can also be found in water damaged buildings, interestingly. But another infection that I failed to mention is something that's come up in the last several years called tick-borne relapsing fevers. Tick-borne relapsing fevers are a species of Borrelia. They're thought to be kind of a cousin to Borrelia burgdorferi, and can cause Lyme-like symptoms, but will not cause a Lyme test to come back positive. So the other interesting thing about tick-borne relapsing fevers is that they can cause episodic fevers or episodic symptoms. So people may feel like they have a fever, flu-like symptoms, may feel that way for a few days, might feel a little better for a few weeks, and then have these sort of episodic events where they feel like they're sick and then they improve in between. There are probably 15 species that we're aware of right now worldwide. There's 8 that are more common in the US. The testing, when we do use specialty testing for Lyme, we use 2 main companies. There's a number of companies out there, but we use IGeneX out of California. They've kind of been around for the longest. They do a lot of blood-based testing, although they did come out with a urine test not too long ago. And they are able to identify several species of tick-borne relapsing fevers. I think they're looking at 5 now. They're also looking at several species of Borrelia. So when we're looking at Borrelia through LabCorp testing, we're looking at one species that is likely most common on the East Coast. But there's probably 100 species of Lyme in this country alone, probably 300 worldwide. So that in and of itself can give you a good idea as to why testing for Lyme is so tricky. The other thing that makes it tricky is that Lyme dysregulates the immune system. So it's not uncommon for us to see people that have diminished IgG antibodies. IgGs are the ones that are formed after your body has seen an infection. I like to say IgG stands for gone. You had it previously, it's no longer there. IgM would be you have the infection now, current in the moment. With Lyme, that is very tricky because you can see late stage illness still having IgM positives. So it would look like you still have an acute episode of Lyme when you actually have more of a chronic version of Lyme. And that goes that speaks to Lyme's incredible craftiness and its ability to continually change and evade the immune system. So not only does it not hide out in the bloodstream, it likes to hide in tissues. All of these infections do. It's very difficult to find any of these in the bloodstream. So PCR testing in the blood is not something that we use very often unless the immune system is really not working very well. Then occasionally we'll find it there. But usually for IGeneX, we're looking at antibody testing. So IgG and IgM, they do have a much more sensitive test than the Western blot. The IGeneX panel that we like to use is $1,600, which is pretty expensive, but it does cover several species of Babesia, several species of Bartonella, Anaplasma, Rickettsia, tick-borne relapsing fevers, and Lyme. The other test that we like to use is DNA Connections out of Colorado Springs. That is a urine-based test. It is a PCR test, which is more familiar now thanks to COVID, but PCR picks up DNA material in the urine there's 5 markers on that test that look for Borrelia. I believe there's 2 species on there for tick-borne relapsing fevers, 3 of Babesia, 3 of Bartonella, Anaplasma, and Ehrlichia, and that one is $600. So none of them are inexpensive. The way that we approach treatment and another diagnostic tool that we use is called autonomic response testing. Autonomic response testing is a form of muscle testing, which is based on quantum physics and energy fields. The physician that developed the method of muscle testing we use is Dietrich Klinghardt, who is a German physician. He also has a PhD in studying how the immune system and the autonomic nervous system interact. So oftentimes when I first see somebody, we will start off with detox. Detox is incredibly important, I think, prior to starting any types of treatment, because when you're infected and inflamed long-term, those detox pathways tend to become jammed up. That's often a number of our patients we see have challenges in detoxification. Many of you are probably familiar with MTHFR, which I think has gotten a lot of press when really probably a lot of other things are really creating many more problems than that. MTHFR is a gene that affects methylation, but anything that's as important as methylation has multiple pathways in the body that are used for that. So a number of people find MTHFR and think, oh my gosh, I have MTHFR, I'm genetically flawed, I'm not going to be able to get better. And that definitely is not how we see things play out in our practice. as we identify all of the different contributing factors to why somebody is ill and start to treat those things, that's usually when we start to see movement and response to treatment. So detox, again, super important, incorporating something into our everyday lives like infrared saunas, ionic foot baths, something like dry skin brushing for the lymphatic system or rebounding. Even lymphatic massage is great. But infrared saunas and Epsom salt baths are wonderful. Infrared saunas can actually detox many of the things that we're looking at trying to get rid of, including many chemicals, some metals, and is actually one of the best things to use for mold. So many people, by the time they get to us, have already been incorporating a number of these things, but I usually like to encourage them to start working on detox and continue working on detox until we're no longer on this planet, because our environment is getting progressively more and more toxic as time goes on. So it's something I believe we all need to do daily. The other things that we use are a lot of homeopathics, a lot of herbal remedies. We do use antibiotics, antiparasitics, antifungals, prescription medications. And most of our patients at some point, there are certainly exceptions where some people seem to do much better with pharmaceuticals. There are other people that do great entirely with herbals. So there's by no means anything that says, if you've been diagnosed with Lyme, you absolutely have to do antibiotic treatment. The great thing is we have enough tools now that very few of our patients end up needing IV antibiotics. We do that if needed, but for the most part, that's not necessary for most patients. So we usually start with an approach kind of optimizing detox. We use some homeopathic drainage remedies for that as well from a company called Picana. And then depending on the patient, we do have some patients that are very, very sensitive, especially those that have been exposed to mold or, have sensitivities to any sorts of smells, chemicals. Some of our patients have gotten to the point where they're down to eating 5 foods and cannot tolerate much of anything. That is not the majority of our practice, but certainly is a certain percentage of our practice, and it seems to be getting larger. There are other modalities that we use for patients that are very sensitive and have what's known as mast cell activation, which can be triggered by mold as well as chronic infections. So what it comes down to is a very individualized case-by-case approach. We may do specialty testing. Oftentimes, by the time people end up at our office, they've seen multiple practitioners, have had a lot of different tests done. We've seen patients that have worked with other functional medicine practitioners that have not been treating Lyme. We've seen patients that have even treated mold and have not gotten better just by treating that. So mold is something that is a common thing that we see. Kind of like Lyme, nobody believes that mold exists in Colorado because Colorado is so dry. But I have a number of patients who have lived horror stories of finding mold over and over in their homes. Oftentimes when people are exposed to mold, they seem to find mold wherever they go. They'll be exposed to mold at home. They may be exposed in their workplace. Mold can be found in cars and vehicles. Mold is actually, I believe, tougher to treat often than Lyme and co-infections. And until probably a number of years ago is not something that we looked at right away, but would look at when people maybe weren't improving after 6 months or so. Now it's something that we ask about from the very first visit. If somebody's been exposed to a water damaged building, and oftentimes the most common answer that we get, especially in people living in Colorado, is no, there's no mold in my house. It's too dry for mold to grow. So that's something that we always are thinking of, always keep on the back burner, even if there's a negative history of it to begin with. Mold, like Lyme, is very challenging to test for. Many of you might be familiar with Richie Shoemaker, who's a medical doctor who is credited with bringing mold to the awareness of the medical community, at least those of us that do this type of medicine, and mold toxicity being something that makes people sick. So prior to that, and his work has been around, I think, for the last 15 years or so. Mold was commonly recognized as an allergen, something that might cause asthma or allergies. As Shoemaker's work progressed, it was realized that mold and mold toxins could actually cause an immune response that could make people very sick and cause dysregulation of the immune system, which is often where we see infections and reactivation of infections occur. Most of the time in our patients, when the immune system isn't effectively working, and there are infections or mold, infections will actually modulate the immune system to make you a good host for them. So they tip the immune balance away from your body being able to get rid of infections and tip it towards autoimmunity, asthma, allergies, those types of things. So mold contributes to that as well. And mold often is something that keeps the immune system dysregulated and allows for the infections to persist. Mold is the toughest thing to treat because finding it in patients' homes is difficult. Nobody ever wants to believe, for good reason, that they have mold in their house, because that is a big rabbit hole that is often very expensive, very challenging to find good professionals to work with to inspect and be able to find mold. We've had patients go through 5 inspectors only to find the 6th one actually figures out they have a huge mold issue. Treatment is not, or remediation is not cheap, often in the tens of thousands of dollars, and often leaves patients wondering, do I have to move out of my house? Do I have to get rid of everything I own? Mold, like Lyme, also can create a lot of individualized symptoms. That you can have 5 people in a house. 2 of them are incredibly sick. Some might have neurologic symptoms, psychiatric symptoms. There have been case reports of acute schizophrenia or other psychological disturbances with mold exposure, definitely dissociative types of symptoms. Another person might have rashes or allergies. Somebody else may have asthma. And usually there's one person that is totally fine and thinks the rest of the family is crazy. Or there's one person who's really sick and the rest of the family's fine. And it creates a lot of challenges for sure, not only in trying to persuade everybody that it's an important factor, but trying to find it. There's a number of testing modalities, plates that aren't very helpful a lot of times, but can be. Air testing is virtually worthless. And so oftentimes having an inspector come out to the house and do their due diligence is the best way to find it. We're doing something called an ERMI test, which is through a company called Mycometrics, which is often a dust sample. We can test for mold in the body. Dr. Shoemaker has a whole list of labs. The labs are part of the immune system's response to mold. The challenging thing with that is that it is not just the immune system's response to mold, it is also the immune system's response to infections or organisms that produce biotoxins, which is what mold produces, is also what Lyme produces. So oftentimes if people are looking at the Shoemaker labs, they're not just getting a picture of is mold causing this illness, because there's so much overlap between that and with Lyme and other infections. It's really impossible to say this is from mold. One of the things that we like to test is urine, again, for mycotoxins. There's 2 labs that we like to use for that, Great Plains and Real-Time Labs. And then there's another test called the organic acids test that can be a nice pair with that to give us a better idea of if people are actually colonized with mold, which can happen over time. People can end up being their own mold and mycotoxin producing factories. So it's a lot to look at. The upside to it is that there are a number of things that we can find and intervene with. And oftentimes, we find people that come to our office have not had any success because some of those things have been missed. Some people have been treated for mold, and that has been a common sort of train of thought in some of the community that does this type of treatment, that you should treat mold first, and then the immune system will automatically wrap up the other infections. That is not what we see in our office. I'm sure there are some practitioners out there that have success with that, but most often what we see is patients have mold exposure. We've had a lot that have been treated for mold, but once the immune system is that dysregulated, the infections are out, and it is not common in my experience for them to just kind of go back willingly into their cages. So they usually take a little bit more persuasion. So the great news about all of this is that it is treatable. It's not fast to treat. I often say that this is a marathon instead of a sprint, or that it's like chipping away at an iceberg. Average treatment times, in my experience, are 2 to 3 years. We've had patients that have been in treatment for longer than that. We have patients that are in treatment for shorter time periods of that also. Kids tend to respond really well to treatment, and often can be treated in a year or less. But our approach is to sort of go after everything that we find. When the immune system is significantly dysregulated, we often find reactivation of Epstein-Barr or other viruses, which we've all been exposed to, multiple infections throughout our lives. We often find fungal overgrowth. We often find parasitic infections of the gut and otherwise. Parasites are another thing that are very difficult to find on traditional testing. And that's where the autonomic response testing comes in incredibly handy. I always say it's better than educated guessing. It definitely allows us a more dedicated tool to figure out what is causing a stress to the body. And then we also use it to figure out how to design the best protocol for each individual patient. So as I mentioned previously, we do customize each protocol to each patient. We don't have a protocol that we give everybody for Lyme and mold. We take each person as an individual and personalize their treatment and their treatment time. It is not 2 to 3 years before people start feeling better, but it oftentimes can take 6 to 12 months for people to notice a difference. And in some patients, it takes longer than that. So it is definitely a matter of trying to keep your eyes on the goal and trying to stay positive and focused. But muscle testing is a helpful tool for parasites. You can spend thousands of dollars looking for parasites and never find them until you start treating them. And then oftentimes they start coming out in droves. But it also helps us keep from under-treating. So oftentimes we see people that have been to other practitioners that do testing, say like IGeneX, and maybe Lyme shows up, maybe Bartonella shows up, and that's what they've been treated for, but they have Babesia, and Babesia is a huge immune system dysregulator, as are other parasites. And if those things aren't all treated, then that often is what keeps people sick. So autonomic response testing, along with our clinical judgment and experience, helps us keep from missing important things like that don't show up well on testing. And then it also keeps us from over-treating. So when you're treating a number of different infections at the same time, the clinical picture can overlap, and it's very difficult to tell what you need to stop treating when. So the autonomic response testing also helps us decide that. So I think we're getting close to the end of time, and I want to make sure that we have time for questions. So I guess I will throw the floor back over to Joanne or Jody, whoever's going to be fielding questions, and I'm happy to answer any questions you guys have.
Hi, Joanne, are you there?
Yeah, I'm here.
Okay. Over to you.
All right. So we decided, we haven't had a lot of questions come in, so we've decided we're going to leave it kind of an open discussion
Okay.
for individuals to ask Sheri. So I'll kind of call out your name and you can ask your question. And I believe at the beginning, Sue had asked a question to Jody. So Sue, let's turn it over to you so you could ask your question to Sheri.
Okay, thank you. And thank you everybody for doing this. She kind of answered a lot of my questions because I've been sick for 30 years and by two different doctors. One said I had Lyme and one said I had Babesia. So I was wondering like where she thought I should start first. So I guess the detox is first and then each plan is individual per person. But I was kind of interested about the ozone, but if that only works on what's in your blood, or does that also help stuff that has infiltrated your tissues?
Yeah, that's a good question. So, yes, you're right. Oftentimes people are sort of partially diagnosed. So that would be one thing that I would say is making sure that you get the full picture. So if you haven't been evaluated for mold or mycotoxins, if you haven't been evaluated for other types of infections, I mean, we often see reactivation of chronic viruses and those sorts of things. Ozone is a great treatment. And so it's not something that I usually start people on right from the get-go unless they come in interested in ozone treatments. And then we definitely start people there. It does, I mean, it only treats a partial volume of your blood. And so it's not common for people to just do one ozone treatment and then, feel like they're tons better. But the 10 pass is something that I oftentimes will encourage people to work up to. I usually encourage people to start with MAH, how they tolerate it. One, because it's the least expensive ozone therapy we do. Ultraviolet light would be another good addition to that. And then if that's not particularly effective or doesn't move the needle much, then I would start looking at OHT, and then you could go from a 1 pass all the way up to 10 pass. We have had patients that have had a number of treatments other places and then have done OHT and found good success. But I think the important thing is to find somebody to work with that is going to look at all of the different factors that could be contributing to chronic illness. We look at other things like dental infections can sometimes be a common cause. People oftentimes have had wisdom teeth removed way back when they used to just leave them open and would let the skin heal over and then develop a pocket in the bone. So cavitations are something we refer out for some of our biologic dentists to evaluate for that. And it's usually a multiplicity of factors. It's very rarely ever just one thing. So we look at other things like toxins and other chemicals, but mold's a big one. Making sure there are any infections that have been missed. One of the other things that I don't think I mentioned was some of the predisposing things that we see are adverse events where childhood trauma, I think oftentimes can lay the foundation. We see a number of patients that have had pretty traumatic events happen in their lifetimes, oftentimes as kids, and that I think sort of orients the immune system towards being extra protective. And so when something like a chemical or a bug or an infection comes in, the immune system goes to town. So that can be another piece. But I would just make sure that you're working with somebody that can look at all the various factors. And then, ozone could be a great thing to try. It's something that I often put into protocols if we sort of reach a plateau, and sometimes has been a game changer for people.
I have a question. Have you ever seen anybody cured with Morgellons disease? And if so, what was done?
Yes, so Morgellons is complicated. It tends to be sort of a dermatologic manifestation. So a lot of people will have skin lesions, have often been diagnosed as having delusional parasitosis by conventional medicine. Morgellons can be a complicated thing to treat for sure. So there have been a number of studies that have shown a number of the bacteria or infections that we already treat, like Lyme and Bartonella, as well as parasites, could be a piece of the puzzle with that. So again, I would, just make sure that we have had Morgellons patients that have been cured, have gotten better, and it's that same sort of protocol that we would apply to everybody else. Just a thorough evaluation, individualizing the approach, and treating everything that shows up and treating it for long enough. Oftentimes, I think people are treated for a shorter period of time, and it isn't a long enough time period to actually resolve the underlying issues.
So let me understand that you said you cured patients from Morgellons?
Yes, we've had patients with Morgellons that have come in, and cure is an interesting is an interesting word, and one that's been debated quite a bit in the Lyme disease community. Do we ever really cure people, or do we get, just get people into remission? Do we ever actually rid the body of all of the infections? And that's debatable, but I think, what we have seen is we get the immune system functioning again, in control of the body, and instead of the bugs running the show. And yes, we've had patients with Morgellons that are no longer suffering from that.
What was the last step? What was the last? Because I've only had it since October, but the Charles Holman Foundation sent me a message saying that my results so far have been miraculous. So, but if you looked at me, you would say that I'm 100% cured, right? But I'm not. I know that there's residual stuff, because when I massage myself, I can still bring out some of the cocoons. Okay, and so they're attacking my joints now. So I do no longer have an external manifestation unless I massage it. There's no lesions, but they're still there attacking my joints. So what is the answer for that?
Yeah, I mean, it's complicated. I wish I could just give you take this and you'll be cured. But like we were talking about, I would be suspicious of other infections like Lyme, Bartonella, Babesia. All of those can attack the joints. So if those haven't been addressed for long enough, that would be where I would start. It's great that the skin manifestations are no longer showing up, because that can be very difficult to deal with. But especially if you've only had it since October, that's 6 months or so. I would say it is certainly not long enough treatment to eradicate the body or get rid of infections like Lyme or the other co-infections. My experience is that can take 2 to 3 years, maybe a shorter period of time if you've not had it for very long, but 6 months would be too short, in my opinion, for treatment. So I would make sure that those other things are getting addressed.
Hey, Joanne, are you on mute?
Okay, can you hear me?
We can hear you now. I think you're on mute, yeah.
Okay, so it's being strange. So we have our next question is from Elise. Elise, go ahead. Elise?
Sorry, I was trying to find my question.
You know what? I actually have it. Your first question was about hormone pellets.
Yeah, thank you.
You're welcome.
What are those, and tell me more? I've done the Wiley protocol and prescription hormones, and nothing's changing.
Yeah. So pellets are a method of hormone replacement delivery. You can do testosterone, you can do estrogen. Those are the main ones that we do in our office. It is an in-office procedure that involves making a very small incision in your gluteal area, and then using a device to put the pellets sort of into the fatty tissue. And then the hormones are released slowly over time. So there's less of a fluctuation in the dosage of hormones. It's not for everybody, but it is, again, something when you talk about individualization of treatment approaches. I have had some patients, women in particular, that have tried testosterone and other methods, whether under the tongue or creams, and have not found benefit from that, and then have used testosterone in pellet form and have noticed improvement in sleep, pain. I wish I could say we see a lot of restoration in sex drive, especially in women with that. Sex drive is complicated for women, but it's just a different delivery system for hormones that if you've tried other methods of hormone replacement and haven't had success, could be worth trying. But it is a little in-office procedure, and then it depends on your level of activity. Usually, when you're more active, you kind of burn through the pellets a little bit more quickly, but could be needed to be replaced or done every 3 to 6 months or so. And they're also great for guys. Guys aren't really usually good at rubbing creams on themselves. So oftentimes pellets are a nice way to, sort of have your hormones implanted and doing their thing without having to remember to put something on a daily basis or take something.
Is this a one-time thing, or are there more than one time?
Yeah, so it would be I never start anybody on pellets until they've tried other hormone replacement methods first. We don't want to put testosterone in your body in a form we can't take it out unless you've tried it and had good success with it. But it has to be done over and over again. So you'd have the pellets performed, placed, and then 3 to 6 months later, depending on how active you are, you'd have to come back in and get it done again. So it's ongoing for pellets.
And I assume that's not covered by insurance.
Right. Most of the time it isn't covered by insurance. There've been attempts to get that covered by insurance. On occasion, I think some people's insurance have covered it, but most of the time it's out of pocket. And I think our office does pellets for relatively discounted price compared to what I've heard other offices doing it. But yes, it would be out of pocket.
And what would that cost?
I don't know the exact number. It also depends on the amount of hormone you use. So if you're using estrogen and testosterone, and then it depends on the dose. So so dose, that's something that our staff could give you more precise numbers on, but I don't know off the top of my head. And like I was saying, it would depend on what you're using and how much.
Okay, thank you.
Sure.
All right, our next question is from Elijah.
Sorry, I'm having trouble coming off mute. So I have two questions actually. I was curious about the MAH therapy and when that was indicated, when you find it might be most useful for a patient dealing with Lyme and co-infections, and kind of what level of efficacy you see it have, or if there's even enough evidence to really speak into that adequately. My second question is, I think, a lot of us who have been in the Lyme community for some time are wanting to do something. And we would love to see public health take a stance and, do prevention, do awareness? Do all of those types of things change the question, or sorry, change the testing? So I'm curious if you are aware of any public health measures that are going on in terms of that, trying to change the story a little bit. And if not, what your suggestions might be as far as how we can sort of get involved.
Okay, yeah, thanks for those good questions. So MAH is a great tool, and it's hard to say, you're right, efficacy, because everybody responds to different treatments. So unfortunately, it's something that we do muscle testing for, but so it can, that can give us an indication of at least the dosing, or if that looks like a good time to add MAH in. Oftentimes I'll tell people just to try it and see how their body responds to it. It's not often something that I start patients on initially, just because of the cost. And, it takes about an hour, which isn't a huge time commitment for MAH, but typically, we treat mostly with herbs, or maybe, medications, homeopathics. That's kind of the mainstay of what we use initially, and has the best data as far as the Lyme data goes. But oftentimes, if we kind of reach a plateau in treatment where patients seem like they're, not really kind of moving one way or the other, that's a time that I will introduce Ozone Therapies. And I do like to start with MAH, just because I think it's better to ease people into it. I've had some patients respond better to MAH than they do to higher dose ozone. And if that's the case, then that's pretty awesome, because it's less expensive and takes less time. As far as percentages, you're right. It's difficult to say how many people, respond to that versus how many people don't. I would say the majority of patients notice some sort of difference when we do IV therapies. And for some patients, it's a game changer. I've had some patients transition over. Teenage girls tend to be a difficult population to treat as far as taking tinctures, which is a lot of what we use, tinctures and pills. And so we've transitioned over to using ozone instead for treatment, and that's worked really well. I've also had people that have been treating for a period of time that we've transitioned over to ozone therapies, and that's been a game changer, and that's what got them done with treatment. So there's also treatment fatigue, where people get tired of taking pills and tinctures, and so sometimes we'll add it in then. So again, a very case-by-case basis as far as when we'd use MAH, but I think it's safe enough for most anybody to try it. The second question is tougher for sure. And I think organizations like this are, sort of the best ways to get involved. The My Lyme data through LymeDisease.org is another great project to get involved with. It's non-biased. It's just patients contributing their information and what's worked well for them and what hasn't. And they're really looking at sort of expanding and using big data, because there aren't any pharmaceutical companies or anybody that's really interested in doing large scale studies on Lyme, because there's not really any money in it. So organizations like that are great to be a part of. Also the Colorado Tick-Borne Disease Association, any of the local platforms like that are, looking to make a bigger impact more broadly. So those would be some of the best ways to get involved. Live Lyme is another great organization that's local to Colorado, and those guys are, I don't know if any of you know Olivia, who's been treated by Dr. Horowitz, one of the best Lyme doctors in the country for a number of years, and she's doing great, but her whole family is involved in spreading the word on Lyme and talking to Congress and getting more research going. So there are some organizations like that, but as far as big policy goes, often patients come in and say, when is conventional medicine going to, get on the bandwagon and start to believe that this is a thing? And, I don't know when that is going to actually happen. But as long as, there's more awareness and people that are aware and treating, then I think that's kind of where you have to start, is getting yourself well, and then just using kind of your own story and your journey to be able to reach out and help other people, which is what Jody and Joanne are doing as well.
Okay, our next question is from Luke.
Hey, Sheri. I just wanted to know, if Lyme is ever fatal other than kind of short of heart blocks. And then you touched on trauma too. What kind of measures help with trauma mitigation, neurofeedback, EMDR, et cetera?
Yeah, so Lyme can be fatal. Thankfully, we don't see it very often, and typically it is associated with what you were speaking to, and most commonly heart diseases and dysfunction of the electrical signaling in the heart. Knock on wood, we don't have a lot of fatalities in our Lyme population, but it definitely is possible. Lyme also can affect pregnancies. So it's a common cause of first and second trimester miscarriages, which is not as commonly known, and can affect fetal development in a number of ways, cardiopulmonary, so the heart and lungs. But thankfully, we don't see many people dying from Lyme, even though it definitely can happen. The trauma piece is a big one. And I would just say, being willing to look at that. Actually, two organizations you wouldn't think of as being very progressive, Kaiser and the CDC, were the ones that did the ACE study. It stands for Adverse Childhood Events. And I believe they did it in the 70s, and they showed it's a simple 10-question questionnaire that you can find online if you look up, adverse child events, or, what is my ACE score, ACE. And they found that people that had childhood trauma were much more likely than their age-matched peers to have depression, autoimmune diseases, cardiovascular diseases, and die from all-cause mortality than people that had not had those events. And those events can include things like divorce, somebody in the family going to prison, a parent dying. The original questionnaire is only 10 questions long, and then I think they expanded that. But I think, as I had mentioned earlier, kind of the way I think of trauma informing the body, especially from childhood. Children are not equipped to deal with traumatic events that happen to them. And so oftentimes are not supported, or don't have an adult that is helping them through that process to help digest or manage the trauma as it's happening. So oftentimes trauma gets stuck in the body if it's not dealt with or allowed to sort of move through. So working with a practitioner, trauma therapy can be something to do. EMDR can be helpful for a number of people. I've had some people that have gotten activated or further traumatized by doing EMDR because it sort of brings up the previously traumatic situations, and the brain has a difficult time telling the difference between what's happening currently and what happened previously. But it's an ongoing thing, an ongoing process. And I can tell you oftentimes is something that I see in patients that aren't healing with all the other things that we're doing. It can be because they have a significant trauma history. Nobody wants to delve into childhood traumas. It's not something you can take a pill for. It's not something that's easy to treat, requires a lot of work and kind of ongoing dedication. So working with somebody like Lana in our office can be helpful, but patients have found, I would say, just going with something that speaks to you as far as working with that. Neurofeedback can be helpful. There's a type of neurofeedback called lens that can be good for more sensitive people. And it's a type of neurofeedback that uses low energy stimulation to the brain to sort of disentrain it from dysfunctional or sympathetic types of responses, fight or flight, and getting back into parasympathetic, so the rest, healing, digest, detoxify states where healing can occur. There's a website called OCHS, OCHS labs.com, where you can find lens practitioners, and it's sort of like a counseling along with neurofeedback. Tends to be, in my experience, a little more effective for our patient population than traditional neurofeedback, and tends to work a little bit more quickly, maybe in 10 sessions versus 25 to 50 with traditional neurofeedback. There are a couple of other types of therapies that we use for particularly sensitive patients, and that's called DNRS, or Dynamic Neural Retraining System. That's from a gal named Annie Hopper, who's I think she's a clinical psychologist or a social worker who had a significant experience herself, and came up with this methodology that involves an hour a day of training for 6 to 12 months to sort of retrain that nervous system out of fight or flight. There's also Gupta's amygdala retraining program, which is similar. So, but people have done everything from, Reiki to shamanic healing to all types of, herbs, ketamine. I mean, there can be, any number of, with psilocybin and some of the other assisted types of therapies these days. There's a number of ways to approach trauma.
Thank you.
You're welcome.
Okay, our next question is from Heather.
Hi. Can you guys hear me?
Yes.
Are you guys able to treat and test for there's a parasite called Amoeba histolytica, which I was told from other people that I know that have gone to an ashram in India, and one of them's a naturopath and back in Vermont, that most people that go to this certain ashram, Amachis and Kurla, gets this certain parasite, but they only know of a doctor in New York City that treats it and tests for it.
Yeah, so Amoeba histolytica you can find on a number of the stool tests, but so, Genova Diagnostics, GI Map, there's actually a parasite, my favorite parasite test is from Colorado, and the physician's name is Dr. D'Angelo, and I am blanking on the name of the test. It'll come to me in a minute. But often the tricky thing with parasites is oftentimes they nestle into their little nooks and crannies, and so just getting one stool test will often miss the parasite. So that's one of the reasons that I love autonomic response testing. I can't tell you how many times I've had people, do a specialty stool test because, the standard ova and parasites testing, even the PCR testing done by LabCorp, most of the time misses parasites. So traditional lab testing is very difficult to find parasites. But even on the specialty tests, if you're just getting one stool sample, you can often miss parasites. So I've had a number of patients who had negative testing on even specialty stool testing. We found parasites on muscle testing, started treating them. And one case in particular, she'd grown up on a farm, and within a couple of months of starting treatment, she was passing hundreds of worms. It is para-wellness, Jody. Thank you. So after we did the testing through autonomic response testing and started treating her, then I had her send her stool to para-wellness. and Dr. D'Angelo found 3 different parasites. So oftentimes it's a matter of, kind of getting some treatment going. And, that's another thing that I see with Lyme testing too, is oftentimes people test too early in the course of treatment where they haven't really been treated yet. And so the bugs are kind of nestled into their little nooks and crannies and don't reveal themselves. So it can be tricky to try to pick them up. But yes, Entamoeba histolytica is something that a number of the specialty stool tests look for. Something we can find on autonomic response testing, something we could definitely treat.
What do you treat it with?
It would depend on the person. Again, we have a number of different therapies that we can use for that. So parasites, oftentimes, if there's one in there, there's multiple in there. So most of the time, our parasite protocols end up lasting for, in people that have significant parasite loads, can last for up to a year. So it's definitely not just like, here's your parasite medicine, take this for a couple of weeks and you're done. Typically we'll end up rotating through herbal parasite treatments. And then we do use a number of pharmaceutical parasite treatments as well. So it would depend on, what all showed up. But that's one thing that we use muscle testing for also, is to determine, what to use for treatment. But most of the time when we're treating parasites, that's what it would look like, is a combination of herbs and then maybe medications if needed.
And so I actually grew up on a farm too, and we used to walk barefoot in the fields, and we always had dogs and cats in the house. And I'm wondering about my family, and also I came back from India and stayed with different family members. And what about like ex-boyfriends? Because if it's that contagious that I could get it, they're saying, from an ashram, from staying there for a week. Do you know about how contagious amoeba histolytica is, or other parasites? Like, would you get them with sleeping with someone in the same bed, or staying with family members in the same house and using the same shower, bathroom?
Yeah, that's an interesting question, and one that we get a lot for Lyme too. And I would say that it varies and it depends on the state of the immune system of the people you're with. So it doesn't, just because you have something, let's say you use strep throat for an example, it doesn't mean that your entire family is going to get strep throat, even if they're exposed to you. Same thing with Lyme. We've had a number of patients who have Lyme, and their partners, with moms, a lot of times if they were infected with Lyme and co-infections when they were pregnant, they can pass it on to the baby that way. But parasites, I would say, there's a lot of ways you can get that through water, through food. So it probably wasn't direct, person-to-person contact. But yes, most parasites, some of them are, fairly contagious, pinworms, those sorts of things. But, we're all exposed to a number of infectious sources for parasites. Dogs and cats. They actually did a study on New York salad bars that was pretty disgusting, showing that something like 90% of them had parasite larvae in the salad bars. So I think in this country, we're exposed to parasites a lot more than we realize that we are. But you would be, the type of patient, who's been out of the country, grew up on a farm, those sorts of things, where you would likely need a longer parasite protocol. And in my experience, that's definitely something that that we've seen on a number of occasions, and see people get better from, but it just usually takes a lot longer than you would think it would.
And what is this autonomic testing? Is that muscle testing? Is that the same thing?
Yes. Yep. Autonomic response testing is a form of muscle testing.
And do you think simple things like clay and psyllium shakes and enemas are good at getting the parasites out of there? Because one of my teachers, I've also studied herbs and psychology, and one of my teachers said that when you get slime, if you're doing a enema, that's like a sign that you have parasites.
Yeah, I wouldn't say that enemas and clays, and silica are likely enough to get rid of a decent parasite burden. Most of the time, like we were talking about earlier, it involves rotating a number of anti-parasitic herbs. And in people that have very significant loads of parasites, we often have to use pharmaceuticals, and we often have to use multiple pharmaceuticals. So I don't think there's necessarily a really easy one-size-fits-all way to get rid of parasites. And then the slime stuff could be a number of things. I mean, there's biofilms that can exist in the intestines. Certainly, you know, the gut can get irritated. You can have, you know, mucus that comes out that looks like that. There can be fungal overgrowth. So, you know, and oftentimes when there's dysbiosis or there's something like, you know, parasites in the gut, we'll find other types of infections or overgrowth in there as well, like fungal overgrowth, sometimes even viruses. So, that's the beauty of the autonomic response testing, and then doing some treatment, doing testing with a company like Parawellness is, I think you get kind of a more complete view of what you're dealing with, and then just treating it until it's actually gone, because with parasites you have life cycles and eggs and all those lovely things to think about that you need to make sure you're getting rid of. So enemas and psyllium and diatomaceous earth, in my opinion, would likely not be enough to get rid of a good parasite burden.
But it helps to get some of them out of there, or make your gut more clean so it'd be easier to get them out.
Yeah, possibly. I think it's just it just is not likely enough to get rid of them. You know, they're pretty adaptive. They can end up in other places outside of the gut. So you know, comprehensive treatment. Making sure that you're really getting at all of them. A lot of times, until you start using particular things, you know, you don't see them coming out. So again, I would just do a comprehensive protocol to make sure you're addressing everything that's in there.
Okay, yeah, we need to move on to the next person just to get some questions answered. So the next question is from Julie. Julie?
I'm here.
Okay, good.
Hi, Sheri. Thanks for. Hi, Sheri. I have a question. So I used to be a patient of yours for a long time. So since I saw you last, I've never had an improvement, and I've been treating off every day. I treat. So I wonder, like, how I know I get that some people take longer. But I wonder, like, how long do you wait and not have any improvement before you try something different?
Yeah, and that's a good question, and one that we're always trying to figure out is what is going on with patients that don't respond to treatment. And so, I mean, I've seen a number of patients where it just takes persistence in treating and kind of staying with it. I mean, I have one patient that was incredibly sick, and it took her 8 years of treatment, and now she's back to working and has pretty much fully recovered. So for some people, it's a matter of time, and just like we were talking about earlier, kind of making sure that you're addressing all of the different factors that could be contributing to illness, and then just kind of going back again and again if you're not responding, and saying, okay, what haven't we looked at? You know, what haven't we done? Where could we be missing something? You know, like we were talking about earlier, the trauma piece can be big. Sleep is something that can be an underlying thing that often is missed. So I often like to rule out sleep apnea, even in people that don't, you know, feel like that's happening. And as you know, mold can be a big thing, and sometimes the immune system gets turned on, and even after you're out of mold, or mostly out of mold, or hope to be out of mold, the immune system can still be reacting to that. So that's always a tough question, because
it's so frustrating, because as you know, I've tried so many things, and right now I'm with I went through Dr. Elliott, you remember him. And I'm working with Eva Stanley and doing some laser treatments, some brown gas treatments, some, you know, and I still do the detox. As you know, we always will do detox. But I wonder, like, how do, like, am I even on the right path? I know treatment is the right path, but what I'm doing, is that right? And, or do I go to another treatment? I'm so nervous because, you know, I've spent so much money. And, but also I want to make sure I'm doing the right thing. And I want to make sure that I am doing the right treatment. So so your example of somebody said it took her 8 years, was there something different that you guys did that you're like, oh, it's finally, she got better? Or was it the same things and then she finally got better?
Right. Yeah. So I think with her, it was the same things, and she did a lot of trauma work also. So she did incorporate that pretty diligently, and continues to work on those sorts of things. I would say, you know, nothing happens quickly, as you know, in this arena. And typically, I would say, you know, give anybody 6 months. You know, if you're going to start treatment for something, you know, try it for 6 months. If you know, if you're not feeling anything by the end of that time, then it's time to reevaluate and see if there's something else that may be worth doing. And then just testing. So, you know, the other thing would be to check for things like mold toxin levels, you know, to check for things like Marcons, to do an organic acids test, you know, just to make sure that you're testing for and treating all of the different things that could potentially be contributing to illness.
Yeah, you tested me for so much. So I have all your tests. And so I know where I am at, and I do have mold, and I moved it out of my house and all that. I don't have mold now. I quit my job and moved out of my house because there is mold everywhere. So I know that could be a problem. I also know that mold can still live in your body. I don't think people understand that. You think that you're away from the mold, so you're fine, but you still have mold in your body. And so I know that could be a problem. But I was with you for like a year or so, 2 years, and no improvement. I've been with Eva now for like a year, no improvement. I'm like, so I'm just nervous. Like, and I went to Dr. Carnahan as well, and she actually is more about letting you or Eva help me than, but because hers is all, she actually doesn't do muscle testing, and you guys do, and I do now. I do muscle testing on myself, so I know what's right, or what I need. But I just am nervous. Like I know I'm impatient, but because I've been sick for so long. I want some sign of improvement.
Yeah. And so what I would say with that is just, you know, sometimes you have to, and I know you have, but you have to keep following up. So if you have an organic acids test, or if you have a mold toxin test, it's not just a one and done type of thing. You know, typically we'll do that kind of testing, implement treatment based on those results, and then retest in 3 to 6 months. So one of the things that you had mentioned that can be very true, and oftentimes is a piece of the puzzle that's missing, is that patients can get colonized with mold in the sinuses or in the gut, and then can become their own mold toxin factory. So the way that we pick that up is by doing mycotoxin tests. And if your mycotoxin tests are not dropping, if those levels aren't getting better with treatment, then we start to be suspicious that you've colonized yourself, or that you're in mold, which is always difficult to rule out, but something that sometimes we have to revisit. Or sometimes people will have kept mattresses or furniture that could continue to contaminate their environments. And then the organic acids test. So continual follow-up with those sorts of things. You know, I would say 3 to 6 months, and then, you know, implement treatment programs based on that, and then reevaluate and make sure that, you know, we've gotten all of the things that we're looking at. So oftentimes I think people stop too soon, and don't, you know, kind of follow through all the way with those sorts of things.
You mean they stop even though, so you're saying they stop when they see improvement? And they
No.
might have stopped too soon, or they stop because they haven't seen improvement and they're like, they give up.
Right. Yeah, right, exactly. And so, yeah, and I don't want to discuss your specific case with everybody else, but I would say, follow up would be good. And to make sure that you actually follow through with all of that. If we find mold toxin testing is positive on your urine, that we follow that all the way through to the end until it's not there anymore. That, we follow the organic acids all the way through until, it doesn't look like you're colonized with fungus anymore. And so that's more what I mean about following it through to the end. I think a lot of times people partially treat, don't get full results and get frustrated, rightfully so, because it's not a quick, it doesn't respond quickly. None of this stuff does. So I would just say, make sure that we're assessing everything and then treating until it doesn't need to be treated anymore.
Okay. I just need to do no more testing. I need to spend more money.
Yeah.
I know.
Okay. Yeah. I want to let everybody know we have about 15 minutes and we have some other calls. So if you could just please keep your questions to just one question so everybody has an opportunity. The next up is Shelley. Shelley? Shelley, are you there?
Yep. Can you hear me now?
Yes.
Okay. Hi. I wonder what you recommend for your patient population to get the COVID vaccine. And then what do you think about the similarities between long haul COVID with the similarities of chronic Lyme symptoms?
Yes. Yeah. I was kind of secretly hoping that question wouldn't come up today, but it's a good question. The vaccination is a tricky subject for sure. Obviously, the CDC is recommending everyone get vaccinated. I certainly am, really honest about this with my patients because that's just the way I'm built. And I recommend that everybody kind of go with, their gut feeling about this. COVID has been very interesting and seems to polarize people in all kinds of ways that, that I would have never expected. But usually people have a fairly decent idea about whether they want to get vaccinated or whether they don't. If somebody is on the fence and they're like, I don't know if I should get vaccinated or not, I have from the beginning kind of encouraged our chronically ill population to wait and see what happens, unless they feel strongly that they really want to get vaccinated. I think for some people, they feel strongly that they want to get vaccinated because they feel it will give them some level of protection and some, semblance of getting back to normal. And in some ways, I think that psychological response or effect can be positive for some people. The concerns that I have about the vaccination, could lead to reactivation of chronic infections, which can happen with virtually any vaccine. I've seen a number of patients have vaccine injuries from other vaccinations. And then autoimmunity is another thing that I have a big concern with, especially with something like a vaccine that, will encourage human cells to make virus proteins. What is that going to look like in the long run? Does that stop at some point? I think there's, we're kind of in a big experiment right now. We don't have enough long-term data for me to feel confident in telling my patients that this is safe for you to do. We, luckily have not seen COVID hit our Lyme population very hard, which has been wonderful because we were certainly worried about it in the beginning because, cytokine storms, our patients are already very inflamed and have a significant amount of immune dysregulation. But we've, knock on wood, not had anybody end up in the hospital. Nobody's died. Nobody's ended up on a ventilator. Most Lyme patients are very savvy and are very adept at taking care of their immune systems and know what kinds of things cause stress to their immune systems, have a fairly good diet, are taking supplements, are already on zinc and vitamin D and vitamin C and, all of the important things that help protect them. So, I've had a number of patients that have gotten COVID and have had very mild or moderate symptoms. I've had some whose husbands have gotten it and they have not gotten it. So, I think the death rates right now are 0.1%, and that's definitely higher if you're over 70. So I think it's a very individual decision. At this point, we can all still decide if we could get vaccinated or not. So I've encouraged my patients for the most part to make that best decision, for them based on, what their feelings are about it. But, I do have some concerns about autoimmune diseases and then, just the effect on the immune system. And the trend that seems to be occurring, that there are more and more vaccinations coming out every single year for more and more things. The similarity between COVID long haulers and Lyme is something that's been talked about a lot. And we've started looking at COVID as an immune system dysregulator, kind of like having a mold hit. So, if you are fairly healthy, maybe had some exposure to Lyme at some point in your life, but your immune system's healthy and has it all taken care of, and then you get COVID. COVID would be something that could dysregulate your immune system enough that outcome all the bugs. And a lot of the long haulers, I think, have similar symptoms, with Lyme and co-infections. And there's a number of authorities that feel that that is often what's happened is reactivation of infections that were previously under wraps by the immune system. So we would take the same, approach. And we've had a couple of patients with more of long haulers, and we would take the same approach to them as we do to any of the chronic illness patients that we see, try to determine all of the underlying factors, if there are other infections at play, and just kind of treat everything that we can find to get them back to health.
Okay, so our next question is from Lynn.
Hi, Sheri.
Hi, Lynn.
I was just wondering how big a part EMFs play into illness.
So for some people, it can be a pretty big piece. It goes back to the, individuality and determining sort of which factors are the biggest contributors for each person. Some people are very EMF sensitive and know they are. That's actually one of the things that Annie Hopper, the developer of the dynamic neural retraining system, I think ended up having significant issues with, and she ended up living in a tent out in the woods because she couldn't be around anything. So we definitely do have that subset of our population who are EMF sensitive. I usually recommend that people turn their Wi-Fi's off at night, try to limit exposure as much as possible. Dr. Klinghardt, who's one of our mentors and who developed the autonomic response testing, definitely feels like EMF is a huge factor, to the point where he encourages every one of his patients to avoid EMF to an extreme. He has also done some studies, or has shown some studies out of Europe, showing that mold actually interprets EMF as a stressor. And so if you have mold in your house and the mold is exposed to EMF, then the mold can have a greater mold toxin production, which ultimately can affect people living in the house. So we do have an inspector that we use for that sort of thing if people are suspicious that EMF could be playing a factor in their illness. And he's pretty extreme, but pretty thorough as far as that goes too. And there are a number of things that that you can do as far as shielding, and some people sleep in Faraday cages, or some of those types of things to try to keep their bedrooms as a sanctuary. But it certainly is a concern, and is one of the things that kind of goes into the pot with all of the other factors, with chemicals and pollution and all of the other stuff, I think, that is challenging the immune system. The other thing with COVID, interestingly, initially some of the areas that were hit the hardest were ones that had really embraced and had taken on 5G. So, those of us that do this kind of work have had some concerns that, with rolling out new technology like this, that we're going to see more and more people that are affected by this. So I do think it can be a factor. It just depends, again, person to person. Some people don't seem to be overly affected by it, and some people are very sensitive to it.
Thank you.
You're welcome.
Okay, next up is Jessica.
Hi there. So I have a little bit of an amorphous question, but I guess I'm curious about what post-treatment looks like, and kind of what's a reasonable expectation for health at that point. And I ask because I've been treating for 4 years and, looked at so many different things, and most of my symptoms have improved, but in a way I'm still so the terrain of my body is so different than it was before, like much more physiologically sensitive and quick to inflame. And I just wonder, is that typical and can mean that treatment is still complete and it's just kind of the reality of what some of these infections do to our bodies? Or does that kind of signal that there's more to be treating, if that makes sense?
Yeah, that's a great question. I would want to make sure that there is nothing left remaining that needs to be treated. I think one of the things that happens through the course of treatment that I encourage people to do as much as possible is to really tune into their bodies, listen to their bodies, become more aware of what's going on in their bodies. And but that hopefully shouldn't turn into a sensitivity that is causing problems on an ongoing basis, more of a listening and tuning in and making sure that you're not overdoing it. Most of our patients, interestingly, are very type A overachievers, very brilliant, successful people that have kind of just, burned the candle at both ends, or, push themselves through extensive pain and illness to the point where they just can't do it anymore. Before they end up seeking treatment. So some of that, kind of involves an unwinding of, that sort of personality trait to, something that is more healthful in the long term. But if you have some things that are still lingering, I guess that's where I think looking at everything is helpful. So, some of the specialty testing, looking at hormones, looking at in-depth labs to make sure that, your thyroid is good. There are food sensitivity testings, which normally I don't recommend at the beginning. But, there are some things like that you could do, looking at your gut, your microbiome, some of those things to kind of optimize that. I think can be a nice thing to do as we wrap up treatment, if we're not finding anything else that's still standing out that needs to be treated. But I would want to make sure that everything is truly treated at that point. It also could be, depending on what things are kind of symptomatic wise still there, a nice time to do some IV therapies or things like that, to kind of get some of that to build up some of your resilience, if you will, so you don't feel like you're kind of on the edge of being impacted, getting inflamed, those sorts of things. And even some of the toxin tests, making sure mold's not an issue, making sure Great Plains has a great environmental toxin test. It's pretty scary. It's got a lot of things on there, including organophosphates and chemicals, and so making sure that you're not dealing with some sort of a load otherwise in this modern era that you might need to address more directly. Metals and things like that could also fall into that category. So, I mean, sometimes, people will have metal amalgams that could be, or silver fillings that could still be causing, some level of irritation or challenge to the system. So again, just kind of doing a thorough evaluation and making sure that there's no residual piece that hasn't been treated yet. As far as treatment after we truly clear patients, I always tell people, now it's your job to, make sure your diet's good, eat a healthy diet, lots of real, food, organic, if at all possible, lots of vegetables, whatever diet, your body works well with, but try to minimize sugars, processed foods, gluten, all that kind of stuff, which can cause ongoing inflammation. Make sure you're sleeping well, make sure you have joy in your life, managing stress levels. There are some practitioners that will put people on, maybe a protocol of herbs or something like that ongoing. We tend not to do that. I think muscle testing helps with that also, to see if there's a need for any sort of residual treatment. But Dr. Klinghardt does do that with some patients. So again, I feel like my answers are all the same, but it comes down to kind of what's going on with you specifically, and making sure that you're looking into all of the little bits and pieces to make sure that you're, you've done everything that you need to do.
Okay, looks like yep, I think we got through all the questions today. We are at the end of our time today, unfortunately, but Sheri, Jody and I want to thank you so much for joining us. It was a great talk and we learned so much today.
Thank you all. Thanks for spending time with us on your Sunday afternoon, and pleasure to meet you all virtually. And you know where I am if anybody needs any further help.
Was this talk recorded? Because there was so much information, and that's one
it
of the
was.
things oh, good.
Yes, we recorded it, and I wanted to let everybody know that it will be online at the end, probably by the end of tomorrow, at the end of the day.
On this meetup, or where will it be?
Yes, it'll be on Meetup, and then also I will post it on the Colorado Lyme and Tick-Borne Disease Facebook group.
Okay. I didn't even know about that one. Colorado Lyme and Tick-Borne Disease?
Yes, if you know what, Heather, I'll look for you on Meetup and I'll send you an invitation to the group.
Okay, that'd be great.
Sure, absolutely.
Thank you all so much.
Thank you, everybody. Have a great Sunday.
Thank you, Sheri.
Thank you.